Okay, so uh, this is my presentation on anxiety, depression, and panic. We're harnessing the effects of COVID-19 using counseling interventions, using cognitive behavior therapy. My name is Jessica Lovis-Goforth. I am a part of the Saskatchewan's collaborative uh, Bachelor in Science of Nursing program here at Sask Poly and University of Regina. So the purpose of this presentation is to enrich an understanding of what cognitive behavior therapy is, how counseling interventions applies CBT, and we're going to explore why CBT is important to implement. We'll provide a thesis statement, and we're going to look forward, reflect, and explore applying CBT in the future through nursing. So, this is my thesis statement here. Cognitive behavior therapy provides significant structure in the roles of managing daily lives from unique experiences of anxiety, depression, and panic to amplified experiences in the face of pandemic events such as the outbreak of COVID-19 coronavirus. So, what is cognitive behavior therapy? The principles of CBT, a good portion of this information is cross-referenced between Anxiety Canada and also our textbook by Pollard and the following other authors. So therapy teaches new ways of thinking and behaving through applying new skills that encourage managing symptoms. So the principles are focusing on the here and now, which attends to the current symptoms being faced, knowledge of how and why there are symptoms, do not manage escalated symptoms, and growing self-awareness to recognize cognitive distortions. The other principle here is emphasizing the importance of homework with practicing new skills, strategies, enhances managing the outcome. Practice increases memory and constructs habits. New information and skills can be applied for variety, preferences, and personalization, which enhances person-centered care. So, how counseling interventions applies CBT skills. So, Anxiety Canada speaks here with their definition. CBT involves learning how to change your thoughts, also called cognitions, and your actions, also called behaviors, which is why it is called cognitive behavioral therapy. So, according to the text, thoughts, feelings, and behaviors are all interconnected. The dominant presence of one influences the others. A change of thought from a negative to a positive thought about an event can manifest positive feelings and behaviors. So, how counseling interventions applies CBT skills. Change behavior you can change behavior through gradual exposure while practicing trauma-informed care. You can change your thoughts, your cognitions through critical reasoning, and changing your thoughts and behaviors can transform the way you feel. So what? The CBT is important in that it teaches how to manage and take back control of one's life, relieving anticipatory symptoms of anxiety and depression. CBT is an important counseling intervention that can be applied through ever-changing phases of life, through practice of new coping skills, and enforcing a homework regime that enables a patient to personalize their needs and collaborate it with their preferences. This is important as it enhances a person-centered care and considers tailored treatment based on the unique experiences of an individual, maintaining a trauma-informed practice. This is just a thesis reminder statement. Again, the cognitive behavioral therapy provides significant structure on the roles of managing daily lives, from unique experiences of anxiety, depression, and panic to amplified experiences in the face of pandemic events such as the outbreak of COVID-19. So now we're going to get into just the evidence of how the pandemic has affected the mental health and well-being of the population. And then we'll explore how CBT, cognitive behavioral therapy, could provide that significant structure in the roles of managing those symptoms in the face of traumatic events. So, the effects of women's mental health during the onset and duration of the pandemic was observed to be compromised at a higher rate among the population, illustrating increased symptoms of anxiety, depression, and panic. So, the focus of this research was that women's mental health was compromised at a higher rate because they also faced, they did face more weight bearing in the sense of they had higher job loss, they were at home more, so their house workload increased. Women with families and children, especially, had faced higher symptoms of anxiety and depression, among feeling isolated and feeling more worried and panic about how they were going to take care of their family, as well as taking on the workload of roles for educating their children, as their children were also meant to stay at home instead of going to school as school closures happened. During the second and third waves of the COVID-19 pandemic, the overall adult population's mental health demonstrated to have lowered in perception of stability, just generally overall. Again, like that would have been an increase of anxiety and especially depression by the second and the third waves of when the pandemic was going to ever end, if it was ever going to come to an end, if we were ever going to be able to reduce social distancing and come out from isolation. As well as by this time, we had many other variants coming out to play that were not well known at the time of what their effects were going to be like. So while many individuals may be resilient in the face of the pandemic, a substantial proportion may experience psychological impairment, and others may experience increased symptoms of mental disorders related to anxiety or post-traumatic stress. Factors that contributed to compromising mental health within the population, not limited to. So some of those I mentioned, there were fear of the dangers of the virus, worrying about socioeconomic costs, families having to deal with worrying about their finances as there were job loss on the rise and closures. And worrying about supplies, if we were going to have enough due to all non-essentials being closed down and the border crossing being closed down. Xenophobic fears was on the rise of people worrying about foreigners or travelers who could potentially be infected and be bringing the virus, and there was traumatic stress symptoms of both direct and indirect exposure, of having to worry about wearing masks and hand washing and social distancing, and if that was going to be enough to even reduce exposure. Then there was also a good escalation of anxiety through compulsive testing and reassurance seeking that you didn't have it or you didn't know if you had it. Many people were asymptomatic, and the anxiety of not actually knowing if you had it and were carrying it and bringing it to your family who may be at risk for other comorbidities was a very scary and real situation and event. So to reflect and explore applying CBT in the future through my nursing career, mental health of the population needs to be at the forefront of healthcare. Mental health very directly has an effect on your physical health and your well-being and your abilities to be able to take care of yourself and your family and to move forward in the world, as the pandemic had uplifted and some of the implementations of restrictions with social distancing and such. And many people still feel the trauma effects and worrying about when it was the right time. The evidence of the declined population's mental health status illustrates how important implementing counseling interventions such as cognitive behavior therapy is for the general population, as well as for healthcare professionals themselves. Looking forward, CBT manages symptoms over a duration of practice skills and attained knowledge. So therefore, it is apparent that these skills would be most useful if they were a part of a regime prior to an event to more productively practice self-care interventions aiming to prevent a climax of symptoms of anxiety, depression, and panic. I think this really has to do with productively engaging in that mental health before it becomes jeopardized. And I emphasize such an importance on that because I want to implement that in my own nursing career, not only for myself of making sure that I'm mentally healthy and stable, but before I face real problems out there in the field, but also for my clients that they're mentally healthy and stable before they have to encounter their own daily or life struggles that we all come to face in the future. So to conclude, again, it is important to include CBT as part of a daily practice, to include with patients' mental health, and invest in implementing of self-managing a person's well-being. There is emphasis on patient-centered care and personalization of CBT coping skills here, an emphasis on self-awareness of patients' client relationship and the unique events of client experiences really helps tailor different self-management skills. It is so important to invest the population in the population's mental health into cognitive behavioral therapy, as it offers those tactful self-management skills that can be implemented in climatic events, such as it was evident during the pandemic of COVID-19. Thank you.